Well, I think the challenge is the effect of if you have a lot of astigmatism as a challenge. I always think of astigmatism surgery as a little bit like football. If you want to kick a goal from right in front of the goals, it's like a spherical correction. But if you want to correct the astigmatism too, it's like kicking a goal from the boundary line. So that the goalposts are the same distance apart, just there's less light showing between them. So the amount of astigmatism correction is very effective in that you can actually reduce the amount of aberrations that you get. So when you have astigmatism, you don't really see very well for distance or for near. And if you do see things, they're usually on a little bit of an angle or they're elongated. Whereas when you have laser surgery, you see it naturally as it really appears. Yeah, so that's a good question leading from the last one. Is one of the challenges with astigmatism surgery is the measurements. And measurements are very important because it's the corneal measurements in the cornea that creates the astigmatism, but it's the spectacle measurements that actually corrects it. And there's a little bit of a dichotomy here. Do I correct the astigmatism by the corneal measurements or by the spectacle measurements? Because the more different they are, the worse perhaps can be the outcome. And that's the challenge. And so the way we address that challenge is what we call vector planning, is we don't treat solely by refraction, by the glasses, or solely by the corneal shape. We actually combine the two and take the optimized balance between the two. So at the end of the day, by using vector planning, you end up with less astigmatism on the cornea, and consequently the cornea likes less astigmatism. That's one of the surgical goals. You can actually see better for it. There have been studies performed with vector planning, and I've got to mention Dr. Maria Arbeloz from Oman. Her study on 80 eyes treated by spectacle correction, which is conventional treatment, and 80 eyes treated by vector planning showed the vector planning eyes, not only did they have less corneal astigmatism, as you might have expected, they actually also had better vision. They didn't actually suffer from any excess or increased amount of refractive cylinder, which is, in other words, you're saying you've got something for nothing. You've got less corneal astigmatism, but no penalty in increased refractive cylinder. And so those patients actually did better. So therefore you would say, why are people treating by vector planning versus manifest refraction? Why aren't more people treating by vector planning? And I think further studies are going to show that when we show vector planning versus refractive treatment, like Dr. Alpins showed, or vector planning versus totally corneal driven treatments, the middle road is going to be shown to be better than either of the two extremes. One extreme glasses, the other extreme cornea. The middle road, somewhere up the middle, is really what's going to be the best balance in treatment, corneal and refractive.